Can I request a custom colored lens to change, sorry, cut off, so I assume to change the color of the iris. Um, and the answer is no. This lens sits behind the iris. No one, unless you had the aid of a light source and a microscope, will be able to see this lens inside your eye. Um, at sometimes you can see the eye, so that the lens reflect a little bit of light. You may have noticed that in your parent or grandparent who had cataract surgery, that sometimes you're talking to them, you see this glimmer of light from their eye, and that's probably the only time you ever really see anything from the lens. So no, it's not expected to change your eye color when perceived by someone talking to you or looking at you. These days there are, procedures to change your eye color, and they're very controversial. Not many people do them, but they involve, tattooing the cornea with shades of color, kind of like a permanent contact lens that changes your eye color, so done on the surface of the eye. You can also change your eye color or repair a damaged iris by implanting an iris inside your eye. That is also less common, but very safe to do. So you would just implant that colored iris. You remove the original iris and then implant the colored iris into the same compartment as the intraocular lens, the capsular bag, and it's supposed to look very natural. And it's not something I do. I'm not sure many surgeons do that. Usually it's to repair a damaged iris, but it's very, very new, and I don't know much beyond that it exists. And I've seen some videos, and it looks like a very slick surgery, just like implanting a intraocular lens. And the after images on the microscope, it just looks like a normal iris, except it's not going to move, obviously. So I would say not worth the risk. Your natural lens and your natural iris, when they're working well, is going to be far superior than any artificial lens or iris that we can give to you. With a lens, of course, it starts to dysfunction at about age 40 to 45 or so, and so yes, then it becomes useful to replace it with an artificial lens that then gives you back that range of vision and frees you from using glasses. But the iris doesn't really age, and doesn't really stop functioning unless there was some issue, like you had really high pressures inside the eye or something, or surgically damaged. Then replacing it can be useful and helpful. Thanks.